She asked for help, not after everything fell apart, before. Lindsay Clancy saw a psychiatrist. She took psychiatric medications. She called a suicide hotline. She went to an emergency room. She voluntarily admitted herself to McLean Hospital, one of the most respected psychiatric hospitals in the country. She told medical professionals that something was wrong. And on January 24th, 2023, 3 children were dead. Cora was 5. Dawson was 3. Callan was 8 months old. Their mother killed them. There is no dispute about that. And I want to say their names before we say another word about hers. Because whatever else this story becomes, a murder trial, a psychiatric debate, a referendum on maternal mental health, 3 children lost their lives. Nothing we learn about Lindsay Clancy changes that. But neither does the horror of what happened relieve us of the responsibility to ask what happened to her. Because right now, in a Massachusetts courtroom, highly qualified psychiatric professionals have examined essentially the same history and reached profoundly different conclusions. One says Lindsay Clancy was psychotic. Another says she was not. One says she was so disconnected from reality that she could not appreciate the wrongfulness of what she was doing. Another says she was severely depressed but knew the difference between right and wrong. And somewhere between those two conclusions sits a question much larger than one criminal trial. Can postpartum psychosis really make a mother kill her children? First, we need to understand what postpartum psychosis actually is, because postpartum depression and postpartum psychosis are not the same thing. Postpartum depression can be serious and debilitating. Postpartum psychosis is rare, generally estimated at roughly 1 to 2 cases per 1,000 births, and it is considered a psychiatric emergency. It can involve delusions, hallucinations, paranoia, severe confusion, mania, depression, disorganized thinking. And perhaps most frighteningly, a woman experiencing psychosis may have impaired insight into the fact that what she is perceiving is not real. The American College of Obstetricians and Gynecologists describes postpartum psychosis as a psychiatric emergency requiring immediate medical attention. And this distinction matters enormously in the Lindsay Clancy case. Because the argument occurring inside that courtroom isn't really about whether mental illness exists. There appears to be little disagreement that Lindsay Clancy was mentally ill. The argument is over what illness she had, how severely ill she was, and what that illness did to her ability to understand and control her behavior. Those distinctions could determine where she spends the rest of her life. Months before her children died, Lindsay's mental health was deteriorating. She struggled with anxiety, depression, insomnia. She worried about her medications. She questioned whether some of them were making her worse. Doctors changed prescriptions, then changed them again. At different points, she was prescribed antidepressants, anti-anxiety medications, sleep medications, and an antipsychotic. One provider considered whether she might have an underlying bipolar disorder. Others did not believe she met the criteria. By New Year's Day 2023, Lindsay voluntarily admitted herself to McLean Hospital. She had experienced suicidal thoughts. During the hospitalization, however, she denied currently wanting to harm herself. She denied wanting to harm anyone else. She talked about her children and family as reasons to live. She improved enough that clinicians believed she could return home without patient treatment. She was discharged on January 5th. 19 days later, Cora, Dawson, and Callan were dead. That 19-day distance between psychiatric hospitalization and catastrophe deserves examination. Not because hindsight magically gives doctors information they didn't possess at the time. It doesn't. Not because every psychiatric tragedy can be predicted. It can't. And certainly not because women experiencing postpartum depression or other postpartum mental health disorders should be viewed as dangerous. They should not. But because the mental health system did see Lindsay Clancy. She was not suffering completely outside medical care. She entered the system again and again. And somehow, whatever was happening inside her was not understood in time to prevent what came next. Now we arrive at the part of this case that I find almost impossible to look away from. Forensic psychiatrist Dr. Phillip Resnick testified for the defense. Resnick has studied filicide, the killing of a child by a parent, and previously testified in the case of Andrea Yates, another mother whose killing of her children forced America to confront severe postpartum mental illness. After reviewing Lindsay's records and interviewing her, Resnick concluded that she was psychotic when she killed her children. He testified that she experienced command hallucinations, that she believed an outside force was controlling her, that her thinking had become so distorted that she believed killing her children could somehow spare them from future suffering. His conclusion was that she could not appreciate the wrongfulness of what she was doing and could not adequately control her conduct. The prosecution called forensic psychiatrist Dr. Avram Mack. He reached a different conclusion. Mack testified that Lindsay had experienced a major depressive episode, but not psychosis. He said he did not find evidence in the medical records that convinced him she had been manic or psychotic. And he testified that she retained the ability to distinguish right from wrong. Think about what that means. This isn't social media arguing with psychiatry. This isn't somebody diagnosing a stranger from a photograph. These are forensic psychiatrists, examining records, evaluating behavior, applying professional expertise, looking backward at the same catastrophe, and disagreeing about the most consequential question imaginable. Was this woman experiencing psychosis when she killed her children? And that is exactly why this story frightens me. Because we have spent decades telling people, ask for help. If you are depressed, ask for help. If you're having frightening thoughts, ask for help. If you don't recognize yourself anymore, ask for help. If you think you might hurt yourself, ask for help. And that message is right. We should keep saying it. But asking for help is only one half of the equation. Someone has to recognize what they're seeing when the person arrives. Someone has to know what questions to ask. Someone has to distinguish anxiety from depression from bipolar illness, intrusive thoughts from delusions, insomnia as a common consequence of caring for an infant from insomnia occurring as part of a psychiatric emergency. Someone has to notice when the clinical picture doesn't quite fit the label already sitting in the chart. And medicine is practiced by human beings working with incomplete information. Human beings seeing patients for limited periods of time. Human beings making judgment calls. Human beings who can disagree. The Lindsay Clancy trial is exposing that uncertainty in public, and it is deeply uncomfortable because we want psychiatry to give us certainty. We want a brain in crisis to behave like a broken bone on an X-ray. There it is. There's the fracture. Here's the diagnosis. Here's the treatment. But minds aren't that accommodating. There's another piece of this that cannot be simplified. Mental illness does not automatically eliminate criminal responsibility. That is not how the law works. Under Massachusetts law, the question is much more specific. The issue is whether, because of mental disease or defect, a person lacked substantial capacity either to appreciate the criminality or wrongfulness of the conduct, or to conform that conduct to the requirements of law. That is not the same question as, was she mentally ill? The prosecution can acknowledge serious mental illness and still argue criminal responsibility. The defense can acknowledge the physical acts and still argue that severe mental illness destroyed the capacity required for criminal responsibility. And ultimately, the jury has to decide. Not me, not you, not TikTok, not Facebook, not the people standing outside the courthouse. The jury, based on the evidence presented in that courtroom. But there is something the rest of us are allowed to examine. What happened before January 24th? What did Lindsay know? What did her family see? What did her doctors see? What could reasonably have been known? And what can this case teach us about recognizing severe postpartum psychiatric illness in the next woman? Because there is a danger in reducing Lindsay Clancy to either a monster or a martyr. If she becomes only a monster, we don't have to examine the mental health system that treated her before 3 children died. If she becomes only a victim, we risk erasing Cora, Dawson, and Callan. Neither is acceptable. 3 children can be victims. Their mother can have killed them. Their mother can also have been profoundly mentally ill. A medical system can have tried to help her. That same system can still deserve examination. Clinicians can have made decisions they believed were appropriate based on the information available to them. Important warning systems may still have gone unrecognized. 2 things can be true. Sometimes 5 things can be true. That is the terrible complexity of this case. There is also something profoundly gendered happening here. Pregnancy changes a woman's body. Childbirth changes it again. Hormones change. Sleep changes. Identity changes. Relationships change. The nervous system is under extraordinary stress. And then we place a newborn in her arms and send her home. For most women, postpartum psychiatric illness will never become psychosis. I need to say that clearly. Postpartum psychosis is rare. And severe mental illness should never be casually equated with violence. But rare does not mean imaginary. And rare does not mean we get to be bad at recognizing it. Because when the consequence of missing a psychiatric emergency can be catastrophic, rarity is not reassurance. It is a reason for expertise. I keep returning to January 5th, the day Lindsay Clancy left McLean Hospital. She had gone in seeking help. She came out believing she was well enough to return to her family. Her clinicians believed outpatient treatment was appropriate. And 19 days later, everything was gone. There will be years of argument over what should have happened during those 19 days. There already are. There is litigation. There is now a murder trial. There are experts. There are diagnoses. There are competing diagnoses. There will be a verdict, but no verdict can answer the question that matters most to the next woman. What do we do differently when she says something is wrong? Not after the catastrophe, before. Because somewhere tonight, there is another woman awake at 3 a.m. with a baby who will not sleep. Maybe she's simply exhausted. Maybe she's depressed. Maybe she's anxious. Maybe she's having intrusive thoughts that terrify her precisely because she would never want to act on them. Or maybe, very rarely, her relationship with reality itself is beginning to change. She may not know which one it is. Her husband may not know. Her mother may not know. And that is precisely why the system has to know what to look for. The answer cannot simply be ask for help. The promise has to continue. And when you do, we will know how to hear you. Cora, Dawson, Callan. Whatever verdict eventually comes back in a Massachusetts courtroom, those 3 names should be a part of what we remember. And so should this. Their mother asked for help. The system answered. And somehow, it still wasn't enough.